Hello and welcome to Brooklyn Elected Officials. I'm New York City Councilmember Dr. Mathieu Eugene, and today I'm joined by Dr. Rhee, who serves as the Chief of Vascular and Endovascular Surgery at Maimonides Medical Center. Welcome, Dr. Rhee.
Thank you.
Dr. Rhee, first and foremost, let me thank you for taking time from your very, very busy schedule to come over here to give information about vascular disease and endovascular disease. Such a very important topic, and I thank you from the bottom of my heart on my behalf and also on behalf of the community. Before we start, could you please tell us a little bit about yourself?
Well, I began my job as Chief of Vascular Surgery at Maimonides Medical Center approximately 6 months ago. I was in Pittsburgh for 16 years and served as the clinical director there, and they recruited me to head the vascular program here in Brooklyn. And it was nice because I grew up in the New York City area. My wife is from Bensonhurst, and it was kind of a homecoming for me.
So welcome back to New York.
Thank you.
So Doc, you mentioned vascular and endovascular surgery, but could you please talk a little bit about and tell us what is vascular surgery? Let me put it this way. We know that there are very different systems in the body, cardiovascular system, endocrine system. But for the people to understand what we are going to talk about, could you briefly describe what is vascular system?
The vascular system is essentially the system in the body that brings blood throughout the body and returns the blood back to the heart. So vascular diseases involve the blood vessels, whether they're arteries, which take the blood away from the heart, or the veins, which bring the blood back. So any problems with the arteries outside of the heart that involves the conduits for the blood or the vascular system, we treat.
So that means it's about veins and arteries.
Correct.
Correct? So in terms of vascular disease, are there risk factors or situations that make people more prone to vascular disease?
Yes, there are. They're different for the arterial system and the venous system. For the arteries, generally the vascular risk factors are typical of the risk factors that are prevalent for atherosclerotic disease, such as coronary artery disease. So hypertension, high cholesterol, diabetes, those things can affect the prevalence or increase the prevalence of arterial vascular disease. And they can cause blocked arteries, can cause weakening of the arteries, causing aneurysms in the arterial system. Smoking is a big risk factor for arterial disease. A lot of times the smoking causes direct injury to the lining of the arteries, so that can also be a significant risk factor. As for the veins, the risk factors involve mainly increased pressures, such as women get a lot of venous problems because of the pregnancies they've had. You can be born with defective veins sometimes, and that can cause varicose veins or blood clots. So depending on the system, the risk factors vary.
You know, usually when they talk about disease, they mention also family history. Is there any link between family history and the vascular disease?
Yes, there are family links in both peripheral vascular disease related to arteries in the legs, the neck, and the arm, etc., throughout the body. And there are also family links for aneurysmal disease, when the wall of the arteries become weakened and the arteries kind of dilate over time. And this is a problem because it can dilate over time and cause bleeding and rupture and sometimes death. And there are strong family links sometimes. So if your brother or sister had an aneurysm, you might consider getting yourself screened for one.
You mentioned pregnant women, but my question to you is there any difference in terms of gender, male or female? Because we know that the woman at a certain time, the body change, the hormone, the secretion of hormone make a difference in terms of different disease that a woman may suffer form?
Yes, that's a great question. There's definitely a lot of medical studies which have looked at the hormonal influence of how it affects the woman's body throughout their lifespan. But most of the vascular disease in women that are specific to more prevalent in women, such as varicose veins, occur in the earlier period. And there's some evidence that even the latter part of the woman's life, she's more prone because of the previous trauma that she incurred due to pregnancies. The hormonal changes have a little bit more effect on the arterial system. Women tend to have hormones that are a little bit more protective of arterial disease than men. So the prevalence of atherosclerotic disease or aneurysmal disease is actually more common in men than women.
What about age factor?
Age is also a risk factor. The older you get, the more likely that you're going to develop, especially arterial disease. As the body ages, with the high cholesterol, the smoking possibly, it's kind of like putting mileage in your car. The injury occurs over a period of lifetime. The older you get, the more likelihood that you're going to get blockages and weakening of the walls of the arteries.
But and when we talk about disease, usually we talk about what people are eating, the diet. Is there any connection with the diet, what people are eating?
Absolutely. High cholesterol diets have definitely been linked to increased incidence of atherosclerotic disease, and that's what we're generally talking about when we talk about blocked arteries, such as blocked arteries going up to your brain and the carotid artery in the neck, and that's been linked with high cholesterol levels, high-fat diets, etc. Clearly, within the last 10 years, the incidence have decreased somewhat because of the medications that have been available to control the cholesterol levels.
So now, what about sport? The way, the behavior of the people. Sport is important, or can make a difference in preventing, or?
Well, exercise and sports have been linked with generation of a good type of cholesterol called HDL, and that has been shown to be protective of actually developing significant atherosclerotic disease. So yes, definitely exercise always helps at all levels.
Very good. So in terms of the sign and symptom of the vascular disease, how people will know that they have vascular disease? Could you talk about the sign and the symptom, what people would feel or will see?
Sure. They're different for various other various conditions. If you have a blocked arteries, the signs could range from pain in the earlier stages to development of little areas of open wounds that do not heal. And that's a very dangerous sign because that could lead to ultimately gangrene and possibly require an amputation. So it's better to get to those symptoms, those conditions a little bit early, at the earlier stages that they're relatively easier to treat. In terms of veins, obviously pain can occur, and sometimes you can get little blood clots which can lead to problems in the future. So generally speaking, the signs and symptoms of vascular disease is associated with pain in the extremities, swelling, things like that. In terms of aneurysms or the swelling of the arteries due to a weakened wall, unfortunately there really isn't any symptom until it starts to leak or expands large enough as to cause pressure symptoms. So this condition is often called a silent killer, and it's a relatively high incidence of rupture in men have caused Medicare to actually provide funding for screening for men over the age of 65.
I'm glad that you mentioned screening. That was going to be my next question. What about screening?
Well, screening is a very good way to detect disease in the earlier stages. So actually we are very proactive at Maimonides Medical Center for screening for aneurysms and for peripheral vascular disease, carotid disease. Sometimes when you have blocked arteries in the neck leading up to the brain, the blockage gets progressively worse until it completely blocks off or becomes so severe that you can actually have a stroke. So the idea is to fix these arteries before they become a problem. So that's where screening is very important, to catch and detect these arteries and correct them before they become a problem.
Very good, very good. But before we go to surgery, because we know the surgery is the last, if I may say that, intervention. Any other intervention in terms of treating the vascular disease before we go to surgery?
Absolutely. Although my field is called vascular surgery, it's really actually a field of treating vascular diseases with all kinds of approaches. And in fact, approximately 70 to 80% of my patients are treated without surgery, with medical therapy or with what we call endovascular treatment, where we put catheters inside the arteries with you completely awake, and we treat the arteries and the aneurysms from within using minimally invasive catheter and wire techniques, using balloons and stents and other devices to treat the arteries without doing a major open operation.
Your specialty is in vascular disease and endovascular disease. Could you make, explain us the difference between vascular disease and endovascular disease?
Well, the endovascular portion is actually the therapeutic intervention aspect of it. So what we say is we offer the surgical options. We can do the operations to fix the arteries, but we can also do the endovascular option of coming from within the artery. So that's what endovascular means, that we're treating the arteries or the veins from within or inside.
What is, we know that there are veins and arteries all over the body.
Yes.
In the top, the bottom, in the trunk, everywhere. Is there any difference between the vascular disease in the lower part of the body and the upper part of the body or other area in the body? Or they are all the same?
Not necessarily. There are certain types of diseases that affect both parts of the body. For example, the artery disease this type of artery disease that affects the legs, that causes people to have extreme discomfort when they walk because of the blocked arteries. They can get cramping sensation. So that process is very similar to the process in the neck, where you get blockage in the neck artery and cause a lack of blood supply to the brain. That's still atherosclerosis, but other processes like venous processes, diseases that cause varicose veins in women, for example, doesn't really occur in the upper part of the body or in the brain. So those are very location specific. Aortic aneurysms or swelling of the arteries in the main part of the body usually occurs in the belly or in the chest, and that really it's rare, but it can happen in other parts of the body, but it's extremely rare.
There's one specific situation I would like you to put emphasis on it because of the importance of and the danger of this situation, aneurysm, especially rupture of aneurysm. Yeah. Could you give some more detail about that, because the consequences are so, so severe?
Absolutely. Aneurysm, as we talked about, is a weakening of the wall, and the reason why it is a significant problem is because, as we discussed, by the time you diagnose it, it's too late. So that the preventive care is extremely important. So we're very aggressive in screening. Cardiologists, we reach out to cardiologists and primary care doctors to actually feel for these aneurysms, but it's sometimes difficult to feel. But when they do rupture, it's important to know that it's not the end of the road. Many of these patients can be saved using these endovascular or minimally invasive catheter-based techniques. And in fact, the last 2 or 3 that we did at Maimonides Medical Center, we used endovascular techniques to salvage the patient even after they ruptured.
Usually I heard people say that they have a pain in the leg. They say, this is rheumatism, this is other thing. But you mentioned that pain in the leg could be related also to vascular disease. What advice you would like to give to the people who are watching, to the viewer?
Well,
in terms of pain in the legs?
Absolutely. The pain in the legs scenario can manifest as a result of a lot of things. It could be rheumatism, it could be joint problems, it could be knee problems. The best way to screen for vascular etiologies or problems related to vascular is to do a vascular Doppler study or a duplex scan. So if you have a patient who has pain in the legs, it should be one of the things that should be ordered as a preliminary evaluation to rule out vascular disease. So a vascular laboratory study is very important to screen patients out.
So now let's talk about vascular surgery.
Yes.
What are the different intervention or techniques that you use in terms of the vascular or endovascular surgery?
Well,
what exactly you do?
Generally, we see patients in the office with typically pain in the legs, or patients who've had mini strokes or aneurysms that have been discovered by primary care physicians. And we can treat most of these diseases one of two ways. One is by doing an endovascular catheter-based treatment, which we discussed, or doing an operation such as a bypass in the leg, fixing the aneurysm by opening up the belly and replacing that weakened part with a plastic tube. Any artery in the leg or arms or in the body, for example, for that matter, can be treated with open technique. Most patients can be treated with endovascular techniques, but not all. So we have the whole range of services available at our hospital to treat these patients regardless of the location or the specifics of the disease.
The intervention, for vascular disease or endovascular disease, is it different for women and men, for children and adults?
That's also a very good question. Women tend to have smaller arteries, so we tend to treat women a little bit differently in terms of, let's say, the size limitation. If men have their aneurysms fixed at 6 centimeters, women, we tend to be a little bit more aggressive because their normal arteries are smaller than men. So it's all relative to how big the arteries are relative to their normal arteries. So the size criteria are different. In women, a lot of women, maybe due to their childbirth or whatever, are a lot more stoic than men. They present a little bit later in their disease process, so the treatment tends to be a little bit more aggressive in women because of the fact that they tend to have a little bit more advanced disease.
We know surgery is an aggressive technique. Is there any consideration of the age of the patient? Young person versus person, a senior citizen? Or
Right. The age is definitely important, but more important than age is actually what we call the clinical age, which means a 65-year-old patient who smoked, 2 packs of cigarettes a day, has eaten a lot of fatty foods over a period of time, may have essentially the physiologic or clinical body of an 85-year-old, and vice versa. Someone who's 85 could be extremely healthy and could be as healthy inside as a 55-year-old, depending on their history. So yes, in general, age makes a difference because of the fact that as you age, you develop these processes. Given everything is equal, the older you get, the higher risk the operations or the endovascular interventions.
We know that there are so many risk factors. It's going to be impossible to eliminate all of them. But is there any advice that you can give to people in terms of prevention? What can they do, not to eliminate the endovascular or vascular diseases, because it's probably impossible, but any advice in terms of prevention, what they can do to decrease their risk of suffering from vascular disease?
One thing that you can do, as we discussed, is control your diet. Low cholesterol, high fiber diet is always good for the vascular system to prevent less cholesterol deposits. Another thing is exercise is absolutely important to develop that good cholesterol in your body, as well as to lower the bad cholesterol, again, decreasing the deposit in the arterial system. Another thing that you can do is take an aspirin a day, which prevents strokes, prevents actually even colon cancer, some of the recent data. So there's a lot of good things that an aspirin a day can help you with. It has been shown to decrease the incidence of heart disease, etc. So taking a baby aspirin a day, exercise, lowering your cholesterol in the diet, and finally, if you're a smoker, if you quit smoking, that clearly has been demonstrated to help prevent progression of disease.
Mm-hmm. We know also trauma, is one of the factors for endocrine endovascular disease. Could you talk about profession or occupation relation between vascular disease and occupation?
Trauma in general can affect vascular disease. We see patients with gunshot wounds, with injury at work. Any injury that can affect the limbs or the neck or anywhere can affect the vascular system. So trauma related to work is definitely a risk factor for vascular disease. And there's some trauma that's related to injuring the vein in the shoulder area. Some people with repetitive work functions, such as an assembly line worker, where they're doing something repetitively over a period of time, can actually injure the vein in the neck area around the shoulder outlet, and that can cause blood clots. And so we actually, that condition is called effort thrombosis or thoracic outlet syndrome, and we also treat those patients. So any repetitive trauma to the arms, any penetrating injuries such as lacerations or stab wounds, gunshot wounds, things like that can affect the vascular system. And we also use minimally invasive techniques for majority of these patients.
Vascular diseases, are they more severe, among children than adults?
Generally, vascular disease is more prevalent in adults because children are born with pristine arteries. If you see an artery of a 5-year-old, they're clean, beautiful tubes. But even if you exercise, even if you did everything right, by the time you reach 50, you do develop some deposits. I mean, if you age another 20 years, you start developing a little bit of calcium, and it's just a normal aging process. So generally speaking, I mean, I'm not saying children don't get vascular disease, but children get different types of diseases than adults.
I think that you mentioned that the circulatory system, the veins and the arteries, and we know the veins and the arteries, they are very important in terms of bringing blood to the other organs and bringing blood back to the heart. What are the different, if you want to talk about consequences of vascular disease and endovascular disease in terms of other disease related to vascular disease, like for example vision and the effect on the kidneys, if you want to, just to make sure that we help the viewers understand the importance of this very important topic.
Yes, the symptoms can range very broadly depending on what the problem is. So let's start from the head down. So if you have blocked arteries in the neck, it's causing a lack of circulation to the brain, so you can actually present with stroke. Some patients, in fact many patients, we have a very active stroke center at Maimonides. They come in with blocked arteries and stroke, so we have to urgently open up those blocked arteries with either a stent or an operation. We talked about the shoulder problems with the vein. If you have aneurysms in your chest or the abdomen, they can present with pain. And it's pain usually that you've never experienced before. It's very severe pain, and usually there's so much internal bleeding, you are probably taken to the hospital and diagnosed there. If you have blockages in the legs, you have pain in your legs or development of these ulcers, pesky ulcers that don't seem to heal. You have coolness in the feet. you may have developed early gangrene, and those are all signs that you may have lack of circulation in your legs. If you have lack of circulation in your kidneys, you may go into kidney failure. If the blockage occurs in the arteries going to your bowels or your gut, stomach area, you can have pain after you eat, and often that is related to blockages in the arteries.
Doc, before we end the show, could you let the viewer know exactly if they want to contact you, if they want to follow up, to have advice, and to benefit from the services offered by you or Maimonides Medical Center, where they can contact you?
Well, they can contact us anytime through our office at 283-7957, area code 718. And we have 3 full-time vascular surgeons at Maimonides Medical Center. And we take new patients, and we pretty much treat the entire range of vascular diseases. We just recently opened a new hybrid OR, which will allow us to do actually very innovative vascular procedures using the latest technology that is really unavailable anywhere else in Brooklyn.
Very good. Any additional advice you want to give to the viewers in terms of prevention, in terms of awareness?
The final advice that I would definitely give to all our viewers is that if you have any of these symptoms that we talked about, especially pain in the legs, the problems of discomfort in any parts of the body, or even signs of stroke where you have numbness in the hands or feet, difficulty with speech, those are all signs that you could have vascular disease. So I would recommend that you see your doctor and say to your doctor that you're concerned about vascular disease and you would like to be screened. And especially that goes true for patients who have had family members who've had vascular disease.
That means prevention is very important.
Absolutely.
Well, thank you. That's all the time that we have for this Brooklyn elected official. I'm Dr. Mathieu Eugene, and I'd like to thank my guest, Dr. Robert Rhee from Maimonides Medical Center. And thank you for watching Brooklyn Elected Official on the Big Cat TV network.